So we welcome back Dr. Kevin Kavanagh from HealthWatch USA. Doc, good morning.
Good morning, sir.
Let's start with Labor Day weekend, because there is some concern when we talk about the coronavirus as to whether we'll get a surge of positive tests for coronavirus after the Labor Day weekend, as we saw after 4th of July.
Well, that's correct. And we also saw that after Memorial Day. So we've been there, we've done that. We know what happens if you do not wear a mask plus socially distance. You should do both. And remember, most of the cases are now coming from you meeting with close friends or your neighbor who you think, gee, I know them. They won't give me the coronavirus. Well, they have nothing to do with it. And look at the experience that The Rock had. He said this was the worst thing he went through with his life. Both him and his family got the coronavirus. He said that it was worse than overcoming nasty injuries, being evicted, and went through other types of life problems that he's had, and that having the coronavirus and COVID-19 was absolutely one of the worst things he had to overcome. And he got it from a close friend that came over to visit. So this is a setup for a disaster if we do not socially distance and follow public health guidance.
We talk about masks a lot, and the governor has said this week that he would most likely extend Kentucky's mask mandate for another month. Lately, we've been hearing about shields, the plastic face shields. Do those do any good?
Well, they do some good, but not nearly enough good that you can wear a face shield only. For example, there was a picture in our local paper that had a person working in the school that had a face shield on. Well, that I don't believe complies. You need to have at least a cloth mask, and with teachers, preferably an N95 mask. I think our teachers need to have frontline type of personal protective equipment, as do grocery workers. We need to get much more of the high quality N95s out to our frontline workers.
Talk to us about what we've known or what we've discovered from the return of young people to college this fall.
Well, they're spreading the coronavirus primarily because they're acting irresponsibly. A lot of times they're having parties, they're going to bars. Frat parties have been really a major area, as has been, let's have a good time at the local bar. And so I really think that they need to act responsibly. Everything depends on it. I mean, look at UK. They've done everything they possibly can do, from setting up quarantine areas, testing all students, screening students, everything. But it's up to the student to act responsibly. If they don't, they'll wind up closing like so many other universities have. Well, that not only will have an impact on the student, but also the economy on Lexington. So a lot of things depend upon people acting responsibly. And if the students think, well, I'm young, I won't die from this, they really do need to look at what's been going on with the Big Ten and Pac-12 sports teams. There was a correction, and I think I should make it. Earlier this week, we said that it was reported that 10 to 15% of football team athletes that were COVID positive, that tested COVID positive, had myocarditis or inflammation of their heart from the virus. Well, the team doctor from Penn State came out and issued a correction. That's 30 to 35%. So this is very serious. Everybody at college, even the young students, need to take this seriously, wear masks, socially distance.
All right, one of the things that we've been talking about a lot during the pandemic is the fact that we don't know enough about this particular virus to know what the long-term effects might be, but myocarditis, we do. Explain that to us and what the long-term effects of that heart inflammation might be.
Well, this is, as you said, is inflammation of the heart. We've repeatedly stated that this virus affects every organ of the body. So it's not the flu. It catches like the flu, but it's not the flu. And it commonly affects the heart. Some patients with myocarditis may start to get a little bit of fibrosis or scarring of the heart, and that can decrease cardiac function. For a person like me, I may not notice it. I mean, I'm old, senior citizen, sit at the desk most of the day, But if you're a young athlete and want top performance, it may be enough to throw you off your game. So it's something you do not want to get. And of course, some individuals will get severe myocarditis or inflammation. And some viruses that cause this, as you know, can result in heart transplants. I had a niece that had to have a heart transplant. She had a viral infection when she was 10 years old, and this was from a myocarditis. Well, it looks like this virus commonly causes a myocarditis. Luckily, it's not severe in the majority of people. Majority of people, 2/3, don't even get it. But just getting it puts you at risk for having some damage. And all may have some damage, whether you can detect it or not, because this is showing up on tests that they're doing. So this is one of the danger areas of this virus. And as I've repeatedly said, as more and more people are surviving because treatments are getting better, doesn't mean that we can let our guard down, because just like cancer, just like having a heart attack, you may survive, but you still may have chronic problems. And oftentimes, people that would have died and now survive are surviving but dealing with chronic medical problems. And so we need to take this virus seriously.
You mentioned the flu. Let's talk about that for a second, because flu season is on the way. It'll be time to be getting flu shots soon. We keep hearing people warning about the possibility of what they're calling twindemic this winter, of coronavirus and the usual round of the flu.
Well, and that could be an absolute disaster if that occurs. So if you do not have the coronavirus and you've socially distanced, you know you're not an asymptomatic carrier, very unlikely, I think getting a flu shot is going to be a wise decision. That being said, I am hopeful that we will have a dud of a flu season this year, and that may well occur. You know, you can reason out and talk and say, well, we're going to have a twindemic, but that did not happen in the Southern Hemisphere. Because if everybody were to wear masks and social distance, which is a big if in the United States, unfortunately, we could easily burn out the flu epidemic. May not do that for COVID-19, but the flu is not as infectious as COVID-19. So it responds to these public health measures much better and tends to die out. And that's what was seen in the Southern Hemisphere. So I hope that will happen up here. Now, I have to say hope because, as you know, a lot of people think, well, there's nothing to worry about. I'm not going to do much of anything. And if that happens, then yes, we're going to have a twindemic, and it's going to be a disaster, both for a strain on our healthcare system, and also, if you're the unlucky patient that gets both at the same time, it will absolutely be devastating. And in that scenario, I think the rule that, oh, I'm young and don't have to worry, well, that probably isn't going to apply.
Got a text here from a listener wanting to know if you know anything about the amplification rate of COVID tests. This listener says, Brian says, I've heard that higher rates can cause false positives.
I have not heard much about that. That gets into the laboratory science of tests. The important thing to remember is that all tests have false positive and false negative rates. The rates tend to be larger when the tests are newer, and of course these tests haven't even been around for a year. And that when a person is diagnosed with COVID-19 or they have a test, well, you really have to have some clinical symptoms, something to really verify that before I'm comfortable that it's a true case. And so when you see the reports that, well, COVID-19 is just running rampant through the community and 10 times more people are infected than what we know of, well, that's based upon just random testing of the community. And that may or may not be accurate. We just don't know for sure. What we do know is that if you die of COVID-19, you're dead. It doesn't matter whether the test was positive or not. And it's starting to have a pretty good clinical syndrome of what people present with when they start to have this illness. You combine that with one or two positive tests, you then have a pretty good case definition of what COVID-19 is. So everybody that dies, at least in Kentucky, I can tell you, they're investigated and they take out duplicates, and the death statistics are very accurate. If you want the most accurate statistic, in my opinion, that's going to be excess deaths. And I talked about that many, many months ago. And nationwide excess deaths, we were at 200,000 as of August 1st. Actually, we were above 200,000. And that's excess deaths above what would be expected for that period of time.
Before the break, Doctor, you talked about deaths and you talked about excess deaths. Whenever we start talking about deaths from coronavirus, someone will say, well, a lot of things are reported as COVID-19 deaths simply because the hospitals make more money if they report them that way.
Well, that's crazy. First of all, doctors do the reporting. They don't make more money regardless of what the diagnosis is. They're paid for the level of visit, types of services that are delivered. Hospitals, for Medicare, everything is paid by diagnosis. I mean, everything. It's not just COVID-19. So yes, you're going to find some diagnoses that pay more than others. But this has been the system for now 20 years or more. They have baked into the system checks and balances which really prevent fraud. There's auditing, there's RAC auditing, and guess what? There's something called the False Claims Act, where if you're a lowly secretary making minimum wage and you find some scheme of the hospital, you can be a whistleblower and get anywhere between 15 to 30% of the collections of what the federal government then comes in and collects. There are so many checks and balances to prevent fraud, and there is no reason why they would be overcharging for this as compared to anything else, and no reason why these checks and balances wouldn't come into effect for COVID-19. I mean, that is just ridiculous. That is not occurring. And again, the hospital, that's bricks and mortar. They're not the ones making the diagnosis. It's the frontline healthcare worker, and they're not paid more if they check COVID-19.
All right. One of the things that a lot of people have been putting off is visits to any healthcare provider if it's a non-emergency. I know I put off a physical for a couple of months after the pandemic began. People have especially been putting off visits to the dentist, but I understand that you recently braved it and made the trip.
Well, I did, and I'm going to give a call out. It was Dr. Sangden down in Somerset, Kentucky, and did an excellent job. And I have heard this from other people similar to dental offices. Listen, people think going to the doctor is dangerous. No, it's not. It's going to your retail area where people aren't being tested, people aren't wearing masks, they're not social distancing. For me, when I went to Dr. Sangden's office, I waited in the parking lot, was called in. The person behind the desk wore a surgical mask. The person who took me back into the room had on an N95 mask. Every room had a separate HEPA filter, and you could feel the airflow going in. Everything was wiped down beforehand. There was drapes over everything when they had to do drilling. And luckily, that was just on some plastic coating. It was an actual drilling of the tooth. But they had big suctions to suction up the air in case there was aerosolization. They were wearing both an N95 mask, a gown, and a face shield. They had on full hazmat gear and, of course, gloves, everything else. So believe me, I felt safer there than I did going into some retail stores to buy groceries. So do not be scared of going to the physician. I have had dental appointments. I have had surgery at surgery centers. I have gone for laboratory tests. I have gone for my doctor's appointments. And every one of those visits I felt comfortable with. So if you want to be safe, when you call up to make your appointment, ask them what type of precautions they're taking. And if they require you to go into the waiting room and to fill out paperwork in the waiting room, I wouldn't do that. I would want to have kind of a touchless visit. Most providers are giving that, and so call ahead before you visit. But for me, so far, I've had very good experiences.
All right. Lisa, good morning. You're on with Dr. Kavanagh.
Good morning, and good morning, Doctor. I had basically just a question. I'd heard a show on this radio station that said that hospital workers are not required on a regular basis, such as patients that are being admitted. You know, it's a mandatory being checked if you're going to be having surgery or whatever for COVID, but how often are hospital workers checked, and is it something that's just if you have symptoms that they might check them, or is it something that is a mandatory ongoing process every so often that all hospital workers get checked?
First of all, I don't believe that there's any federal mandate on checking hospital workers for any dangerous pathogen. And that's something our group has been pushing for a long time now, along with getting them workers' compensation if they are infected and an economic safety net. And that includes COVID, it includes MRSA, any type of dangerous pathogen. I feel there needs to be federal mandates. So that's one of the things I think will vary between facilities. And before you go there, I would ask them that. I would make sure that they have some sort of a regular screening process. I would assume that's taking place, but I don't believe that there's a federal mandate for it to be done. I think that they've tested healthcare workers in nursing homes. I'm assuming they're doing it in hospitals, but it may vary between facilities. I could be wrong about that, and if I am, please have a caller call in and call me out and say, oh, look, this is what they're doing.
Right. I just feel like that if it's not, it's kind of one-sided, and, you may have patients coming in that's not infected, but if you have hospital workers, even though they may be wearing better protective gear, still, up close personal, if a hospital worker would be carrying something, then, the poor patient is kind of vulnerable. So, you just wonder, how far does this thing go? So that's
Well, but that's going to be the same for any frontline worker, even when you go to a grocery store. In fact, I feel that someone who's working at a grocery store, working at a retail setting, is probably at greater risk than a healthcare worker because they're still having close contact with the public. You've got a high rate of asymptomatic carriage, and they have minimal protective gear. So, as I said, I think your healthcare setting is going to be a safer area. And remember, as we've said before, and I have to correct at least one of the statements, I kind of got recovered versus survived mixed up. But if you're a healthcare worker and you were exposed, by this point, you're probably not infectious. Okay, because let's face it, they work in that setting for 6 months. Most people will get over this or become non-infectious within a few weeks. That's not a good thing to happen for healthcare workers because a lot of them are getting symptoms. But I think that wearing good gear and knowing how to avoid getting infected is probably more common with healthcare workers than non-healthcare workers. But I do agree with you. We need more testing. CDC's advice not to test asymptomatic people is not good. They need to be tested. Frontline workers, all frontline workers, need to be tested on a periodic basis. And that's one of the things we need that we do not have in the United States.
Well, what about the fact that do you ever foresee in the future if you've had COVID, and will there ever be an antibody check to where we can kind of say, or do they know that if you have it, are you more vulnerable to ever get it again? If that were the case, that if you've had it once, it's kind of like chicken pox, you don't really worry about it unless you end up with the other thing, the shingles or something. Yeah, but, it'd be great if they could come up with an antibody check, and that we can move along with our life. If you've had it and been exposed and you're over it, that'd be great. But I hope they will in the future do that.
Well, I hope they will, but we just don't know. And with your example, for example, of shingles, herpes is another virus that will recur. The virus hides in the cells, so you may not have active antibodies against it. And it will then break out. So, and it can break out years down the line. So it is kind of a problem of not knowing exactly what this virus will do.
We are out of time. Dr. Kevin Kavanagh, healthwatchusa.org. Thanks as always, and you'll be back with Jack next week.
Thank you, sir.